it's really clear to me that there is a much bigger problem here that we need to discuss.
There might be more options out there than what's just directly being put in front of you, like removing your bladder.
Because I'd suffered for 13 years with issues since having my first daughter, sometimes you can, through physio, correct that, but other times you do need to have surgery. It's the only answer. That's 13 years of your life that you can't get back.
Hello and welcome to today's episode of Health Applied, the podcast.
I'm Kelly Allison.
And I'm Harriet Gisborne.
And we're going to be having raw, honest conversations about all things health and wellness.
We hope you enjoy. Today is a very exciting personal episode where we're talking to the one and only herself, Miss Kelly Allison, co-host, about a very personal and also quite recent massive experience for you in your tummy tuck operation, also known as abdominoplasty. So you ready to dive into all the nitty-gritty details?
I am, absolutely, indeed. I'm so excited to have this conversation because there are so many women that have been in touch on Instagram just to share their stories, really. And it's really clear to me that there is a much bigger problem here that we need to discuss.
There is, isn't there?
Yeah.
And obviously when you initially went to have the tummy tuck, I feel like there was two sides of real things driving you to have it.
Yeah.
Do you want to tell us a little bit about what those sides were and what really made you, because it was very scary for you, wasn't it, going into elective surgery with your past health experiences?
It was.
So what really convinced you to take that leap?
Yeah, and I think you're exactly right. When you have something elective but you've spent your whole life having health problems and operations, the thought of voluntarily
going under the knife
to your body to give yourself pain and a recovery seems really bizarre. But for me, actually, because I'd suffered for 13 years with issues since having my first daughter, I think it just needed to happen, and I needed to know. I'd done so much research and I needed to know whether it was actually going to help me. So the two reasons were, one was the weight loss. So I lost 5.5 stone. And I was left with quite a lot of overhang, which no amount of gym could fix. Actually, a guy the other day commented on my Instagram and said, why don't you just not have kids? And I was like, and then another one said, why don't you just go to the gym? I was like, do you not think that I've thought of that over the years?
You did so much gym work through your weight loss as well.
Yeah, exactly.
But when it's skin,
you can't do anything about it. And actually the second reason was the muscle repair side. So an abdominoplasty can just be a mini tummy tuck, or it can just be the removal of the loose skin for people who want to, for people who have had massive weight loss and they just want that skin removed. But the other side of an abdominoplasty is also the muscle repair, which is where some women have had stretched, or all women have had stretched abdominal muscles during pregnancy, where they separate naturally to grow your stomach and grow with the baby. At the end of pregnancy, they should then come back together, and some women need a little support with that. And there's great physios out there who provide that support.
I can feel mine separating at the moment.
Yeah.
What's it called?
So diastasis recti is when you have a separation, which is there after pregnancy, which hasn't gone back naturally. And actually, sometimes you can, through physio, correct that. But other times you do need to have surgery. It's the only answer. And that surgery can fix so many things, whether it is slow transit constipation, back pain, urinary incontinence. There's all kinds of things that women are experiencing for a long freaking period of time.
I love that. So you mentioned you had challenging experiences since the first birth of your first child, being Sienna.
Yeah.
What were those things that you were struggling with that made you look for alternative options that you weren't maybe being given on the NHS?
Yeah, so I had a cesarean. It was an elective cesarean, but ended up being an emergency in the end. And I thought, quite naively, having a cesarean birth meant that you would be absolutely intact and perfect down there and there'd be no problems. But actually my experience was that I had this ongoing urinary incontinence, which wasn't urge, it wasn't mixed, it wasn't stress. There's all of these clearly defined kind of incontinence buckets, I suppose, that healthcare professionals put you in, and mine wasn't that. It was just this slow kind of dripping of urine 24 hours a day, but very slight, like nothing major, but it was always there. So you always have to
no.
wear pads, and you feel self-conscious, like you just, it's horrible. And because I was getting chronic UTIs as well, I thought, is that the problem? And is it just because of this incontinence?
Time, a slight leakage.
Yeah, so for 13 years, and I saw so many different experts during that 13 years. I saw 4 urologists, 1 private but 3 on the NHS. I saw gynecologists, I saw uro-gynae combinations, I did physiotherapy.
All for this leaking bladder?
All of it. And actually nobody could identify what the problem was. Not one person ever said to me, there is a surgery. Actually, I lie. One person did say, one urologist on the NHS said to me, one thing we can do is a surgery to remove your bladder. I mean,
how does that even work? Because you see people who have some of their bowel removed with a colostomy bag.
Yeah.
But what's the bladder alternative?
Yeah, I mean, it would be having a bag on the outside of your body which collects urine, but actually it's a major surgery, like sometimes more so than when you're having a stoma with a bowel. And it's not reversible, because once they've removed your bladder,
you can't put it back in.
Exactly right.
So plug it back in.
No, so it's not like.
Oh, that's making
with
me
a
like
stoma,
wince the thought of it. I wonder how
Yeah.
common the operation is. You never hear about it.
Not very, but actually it's normally the people who are, other than for cancer, which obviously then it can be a common surgery in those scenarios, but for women like me, a lot of women are labelled with interstitial cystitis, and those women who are severely debilitated then opt for the bag. But actually, a lot of the time when you have your bladder removed, you can still get those ongoing issues, even when you have the bag. So it doesn't completely eliminate problems or pain, particularly from people's lives, which again, you don't know.
So you were just absolutely stuck. 13 years,
Yeah.
constant leakage,
Yeah.
discomfort, embarrassment.
Yeah. And there'll be so many women listening to this now who, I'm sure everyone can identify with this, say, I don't feel comfortable running. I don't feel comfortable jumping on a trampoline with my child. Going to those trampoline parks like Bounce or whatever it is an absolute nightmare, because I don't want to bounce up and down because I might just wet myself a little bit. Or even laughing. Like when you were saying the other day, we were having a good giggle and you were like, oh no, I've peed myself.
Luckily, only being pregnant.
Yeah.
I've never had
yeah.
it when I'm not pregnant, but you never know this next time around. That's why I'm so concentrated on my pelvic floor exercises. I'm doing them now, trying to like...
Do you know, and it's interesting because with your pelvic floor, you can actually, by doing the Kegels, and sometimes these leaking problems can actually be caused by an over-tight pelvic floor, which actually women continue to do the Kegels, or they do stretching with these little kind of contraptions you can buy online. And that can cause damage. And that's why seeing a good physiotherapist and kind of getting that understanding if you do have diastasis recti is really important.
Cool. I've heard them be called mummy MOTs, where they do a good little examination of you, see what's going on down there, which is mental that we don't have that.
We should have
properly
that
on the NHS.
It's crazy. A lady this morning actually, so one of the reels that I made, which was talking about, so a question that I kept being asked was, why are abdominoplasties, when patients go in for consultations with cosmetic surgeons, why is it that they are not talking about the physical health benefits over and above cosmetic?
And also, how did you find out about those? Because you obviously had the two sides to it, but when you went in and considered the surgery, you were obviously ongoing quite unhappy about the excess skin from losing your weight.
Yeah.
How did you discover and learn about the possibility of it helping your bladder issues?
13 years of research. I think when you're a patient and you're at your wit's end, you will Google the hell out of anything. I joined every single Facebook group. I was trying to find out what was wrong.
Had you heard this for a while, that it might help?
No, I actually didn't know. It's probably, I would say it only became apparent to me in the last couple of years.
Wow.
And actually that reel that I was just referencing on Instagram, that when 314,000 people who, and all of these women are coming forward saying, I've got exactly this. I didn't know that actually there's physical health benefits, potentially, not always, potentially out of a muscle repair with a tummy tuck. And it's really interesting. So I found a study, an Australian study, which was absolutely fascinating and blew my mind. So it was a study on 214 women who went in for an abdominoplasty for various different reasons. And the average age of those women was 42, and the average, and the average amount of children they had was 2. So it's kind of like me. So I saw myself in that study straight away, even though I'm 43 now, but you know. And so the point being, these were out of these women who went in for a tummy tuck, just under half of them on their pre-op questionnaire were really suffering with urinary incontinence to the point.
That's a lot, 50% out of 214.
Yeah. And that was incidental, because actually what they found was that afterwards, out of those, just under half of those women, at the 6-month post-op mark, only 2% of those women still had urinary incontinence. 2%.
That's crazy.
Yeah.
And that's from the muscle repair
Yes.
that happened with the surgery.
Yes.
Because I remember when Kelly came round from the surgery, bless us, I don't know what it's called, but like from a metabolism point of view, Kelly has a very high tolerance to drugs. So I feel like you were like, the anaesthetist told us when you were coming round that he'd given you more or whatever the drug was than like he'd ever done in his career, and it'd like knock out a full-grown adult elephant or something. But anyway, she's still alive and kicking. And I remember your reaction. I don't know if I've told you this. One of the first things you said when you came round, I think you had a fondle, and you're like, I'm dry.
Did I?
And you had this massive realization in the bed. You're like, I'm dry. And I was like, oh my gosh, that's amazing. But then I didn't know whether it was just a very common thing after surgery, because when I've had surgeries, your bladder often goes to sleep for a while afterwards. So I was thinking, I'm so glad you're dry. Let's see how it goes. And I remember I kept asking you like each week afterwards, I was like, are you still dry? I don't want to jinx it. But was that weird? Or like having 13 years of leakage, and all of a sudden just being dry? Like, what did that difference feel like?
It is mental. Do you know, I think actually, controversially, it felt frustrating, and the reason I was frustrated is because of all of those medical professionals that I've seen for 13 years.
You put so much effort into trying to find a solution,
and I think most of them don't know. So I would say all of the uro-gynaes, the urologists, the gynecologists that I spoke to wouldn't know this. And I think of the ones that do, so the cosmetic surgeon, who we absolutely love, who did a fantastic job on me, thanks Dr. Paul. Dr. Paul wasn't able to talk to me about this.
So I remember you questioning it in the consultation.
Yes.
Because it was such an important part of your decision to have the surgery. I remember you came with all the studies, and he just wouldn't entertain the conversation.
No, and there's a reason for that, because so in the UK, cosmetic surgeons are obviously, they're in their lane, right? They're licensed and regulated, and they are performing cosmetic procedures. That's their expertise. The minute that they talk to a patient about anything else that could be a possible benefit, side effect benefit of the surgery, they kind of change their lanes and they cross it over into urology, gynecology, which is not their area of expertise. So in a private setting, that then exposes the surgeon to be at risk, because if a patient woke up and found that they'd thought that they'd paid £10,000 to stop leaking and actually they hadn't, that patient's going to have a bit of a problem.
I guess it comes down to like the black and white of what they're selling.
Yes,
like if you go into, I don't know, Chanel and want to buy a handbag, like they can't guarantee you that you are going to be happy every single day when you wear that handbag. I mean, I would be, but they can't guarantee something not directly linked to it. But is it directly linked?
Well, it is.
Study
it absolutely is, and there's more of them. There's loads in the US. And what I would love to say to cosmetic surgeons right now, even if you don't feel comfortable talking to patients yourself, please do share these studies with them, because they're independent studies. They've been done, they're proven, they are published in medical journals in their own right. And I think just sharing them, saying, you might find this of interest.
I can't guarantee it.
Yes.
But
I can't talk to you about it.
Yeah.
Have a look at these studies.
Encouraging that education piece.
Yes.
Because education and healthcare from a patient's point of view is the biggest driving factor now. Like there's more Dr. Googles, Dr. Claudes, Dr. Chat GPTs than than there's ever been.
Yeah.
I think just sharing that knowledge or encouraging it.
Yeah.
Because especially with yourself, you had so much anxiety around going into elective surgery, and bless you, when we got to the hospital, it was a very panicked time for you because you've unfortunately been in a hospital setting so many times for being poorly, and I guess that creates such a connection in your brain to lack of safety or pain or vulnerability. So actually all of the above.
All of them.
So walking in, like, bless you, it was such a, I think, did they end up giving you some diazepam or something to calm you down? But it would have been so easy for you not to do that. And I feel like a lot of people who might have similar feelings would elect not to do it just for the cosmetic reasons. But having that education piece, that it might just possibly give them the freedom from a bladder leakage or back pain or those are other benefits you mentioned.
Absolutely.
It's and that's why we do this podcast, right? To, like, we're not saying that we're guaranteeing this or promising that.
No.
But it's just spreading the awareness of go and have a read, have an education, because there's not always going to be someone to tell you exactly the answers and predict them. But there might be more options out there than what's just directly being put in front of you, like removing your bladder.
I know, it's wild. And you know, right now, across the globe, 1 in 3 women are living with long-term urinary incontinence that they've had for more than 10 to 12 years postpartum. And 20% of all postpartum women have chronic back pain. Now, those two things we know are directly linked to what can be an improvement through that muscle repair. It's not going to be guaranteed. There's people who would still obviously have ongoing back pain, for example.
For a different reason, potentially.
Yeah, exactly.
But there's a strong connection that if your whole abdomen muscles during pregnancy have to separate, it's your abdomen muscles that hold you back.
Yeah,
up.
exactly.
So
exactly.
A very big correlation there. I wonder if in other countries they connect the dots more. Do you think it's just a UK thing?
I think, I mean, potentially because of the NHS and the cost kind of implication, I guess, is something that a lot of people have commented and said, I feel like the NHS are never, ever going to take this on board because they can't afford it. And actually, in response to that, I would say they can't afford not to. The cost that it would have, that I would have incurred through 13 years of seeing every single specialist, medication. I've had 2 cystoscopies, I've had urodynamics tests, I've had bladder instills, I've had all kinds of things.
Also, long-term medication for some people, like having incontinence can cause real mental challenges, infections.
It's awful.
So many things that would be long-term ongoing medication.
And I've had, I think, 3 or 4 different types of medications at different points. Now, obviously, all of those I pay for my prescriptions, but they're all subsidised. So the NHS is still paying the actual price for those drugs. If you add up the cost of all of those things, all of the clinician appointments, all of the procedures, the medications, over 13
10 times more.
Can you imagine?
Have you done the maths?
No, but I should do. I wouldn't even know where to start because there's been so many appointments. But there is no way that is anywhere near £10,000. It is going to be way in excess. And the problem is the NHS think very short term, so they are looking for the short term solution. But if you look at it in a long term, and if they're planning to operate in the long term, they need to do that because it's going to make a saving for them overall.
Definitely. And I guess for women that are maybe having these challenges, and the NHS, to my understanding, there isn't a treatment pathway that includes this surgery for incontinence.
No, there isn't. No.
And maybe that aren't fortunate enough to be able to afford private cosmetic surgery.
Yeah, I mean, how awful.
Isn't that such a challenge?
It's really sad.
And I think you then start looking at maybe there's no interest finance options. But it's just, it's the price of, it's putting a price on your health. And I guess that's just the juggle that is so often there at the end of the day.
Yeah, and I think some of these women are getting so desperate without having the money to do it properly, and they're going to these random clinics throughout Europe, and some of those clinics are great. You know, there's some really good ones out there that are low cost, but there's also some really dodgy ones.
Please always do your research for going to cosmetic surgeons.
I joined this group on Facebook and I had to exit it pretty quick, and it said tummy tuck recovery, so I thought, oh, that's great, I'll know what to expect, which is part of the reason why I wanted to vlog my recovery day by day, because I wanted a normal, honest recovery.
Kelly's got a great ongoing vlog on Instagram under your Culture Queen account.
the.culture queen.
Where she documents, is it weekly?
I did day by day for about 6 to 8 weeks, I think.
And now you're doing week. I've seen.
I don't do them anymore because I mean I talk a lot about this kind of stuff, so like the medical benefits and but
there's a whole bank on there, so definitely check it out if
loads.
you're considering. And on recovery, shall we dive into your recovery and how you found that? And obviously everyone's experience is different, but tell us a bit about yours.
So the recovery was actually fine. I would say, I mean, I've had 2 cesareans before. I found those very easy recoveries, which I know is not the same for a lot of women. It's very individual. I found that I didn't take painkillers from day 2, and I really think that helped me because I was up and about. I was so determined to be independent, and being on my own and with the girls, and a new puppy.
You're a nutter.
Who
does that?
Me.
A new puppy and major surgery.
Yeah, but I think I was so determined actually to make that change, and that helps kind of just spur you on. I think it's sometimes if you have a big support network around you, you kind of lean into that and you think, oh, I don't have to do that for myself. Whereas I was like, I have to do this for myself because there's no one in the night who's getting me out of bed. I've got to do it myself. So
you're so strong. Also, for a funny story, so when Kelly went in to talk to the surgeon, they said to her, okay, you need someone with you for the first, I don't know, 2-3 weeks, whatever, for that recovery. And being a single parent as well, like just needing support around the house with 2 dogs. I mean, controversial, not a dog person, but there we go. And I found childcare for Cece for the first week because I thought I'll come in and move in and help you for the first week. Turned out I was debilitatingly, I mean, I still did it, but I was debilitatingly sick 24/7 with morning sickness. I don't know who was dying a death more, you or I.
You,
and like
probably.
The smell of, and Kelly's house is beautiful and has like more candles than you could ever imagine. And every room there's so these candles, I was like, I'm gonna die. So I bless Kelly, and then because I don't know whether it's because I was pregnant or the morning sickness, I was snoring like a trooper.
Oh god,
so
it was awful.
I had to
and
go
you were
sleep.
ill.
Oh
you had a cold as well. And I was like, well, I was thinking, don't come near me because if I get the sneezes, I mean that is just to like prepare the first sneeze post surgery. You actually think you're gonna die. Like it's quite bad. So I was like, don't come near me. Go in the spare room.
So I was still there, but like getting yourself out of bed, going for a wee in the night, like all of those things. Maybe I was more mental support and running around the house doing things, but in terms of like physical support,
I was going to say doing things, picking Bandit, the new puppy, up with kitchen roll because you didn't want to touch him.
Oh, don't, that makes me sound so bad.
Poor little Bandit.
I am so allergic to dogs, and Kelly's got 2 little chihuahuas. Well, they're not chihuahuas,
a chihuahua and a Pomeranian.
They're small little things that yap about a lot.
Oh, they're so sweet.
And they just poo everywhere.
They do. Bandit's a puppy. He's not toilet trained yet.
So I go into the kitchen every morning and be like, oh my god, I feel so sick and now I need to collect all this poo. And because I'm so allergic, my allergies are up all the time being around them, and I had to keep picking him up in and out of his cage. And I worked out that because it was so small, I get 2 bits of kitchen roll. I could just, and then you do look back and you think, oh, poor Bandit. I hope I've not scarred him from my lack of affection. You need to get like a naked animal, then I'll be okay with it. Like one of those cats.
Like a skin, the hairless. Do you know my brother, this is off topic, my brother wanted a hairless rat when we were small. My mum went crazy
anyway.
No, literally, like my mum hated rats, and then my brother was like, I want a hair. I was about to say skinless. The hairless.
Be awkward.
My brother probably would want a skinless rat, to be honest. But
gosh.
It was really funny.
Well, maybe we need to find a skinless dog or cat, and then we'll be fine.
Hairless. Don't want no skinless dog in my house. Thank you very much.
Right, reverting back to the point, you were bloody independent because you had to be, because I was a bit useless.
Yeah, absolutely. But I think overall the recovery was fine. I mean, you've got to, the key thing I did, I'm cracking myself up. The key thing that I did was listen to my body.
Yes.
And even so, we went on holiday together 8 weeks after surgery, and that was a 17-hour travel.
Mental when you think about it.
It is, actually. And I was like, oh, I'll be fine, which actually I was fine.
Yeah.
But I was still very conscious. I wore the binder as well, so I think that is a key thing. So I had the Marcom 3-panel binder, which was absolutely fantastic. It feels rigid, but actually it was really quite comfortable to wear.
And like security blanket.
Really secure, yeah. And I realised at one of my first post-op appointment that I was wearing it too tight. I thought it was all about squeeze for the best result, flatten the scar. But actually, then you can't almost breathe, and it's just not conducive to a healthy recovery. So the lady very kindly explained to me that just very gentle compression is all that's needed. And as long as you
stop torturing yourself,
as long as you can put a couple of fingers underneath the garment, between the skin and the garment, then you've got enough wiggle room.
Bless you. And then you had a bit of an episode of some of the painkillers, didn't you?
Yeah. So that must have been day 1. I think that was the day that I got home from the hospital, wasn't it?
The first night.
And and I think, or the second night, I can't remember, you'd gone to the spare room and I'd taken some painkillers which they'd given me, just over the counter ones, but actually they were quite strong, but they made me feel really poorly. All of the ones I had in the hospital, the IV and everything, I was absolutely fine with, but these tablets were not the ones. So I discontinued those very rapidly, and took paracetamol for a couple of days, but actually other than that it was fine. And I think, although the weird thing is, so I'm 3 months post-op now, and the weirdest thing, so we've been in Croatia for the last few days for work, and we walked all around Old Town Dubrovnik, and for anyone who's been there, absolute shit ton of stairs. And what I've realised is, whenever I'm going up and down stairs, or I'm walking or on my feet for a lot of time, not only do you swell slightly, but also your stomach muscles go into a bit of like a vice. It doesn't hurt, but they're kind of rigid, so you're aware of them. It's a really weird sensation, but actually I've grown to quite like that, because it feels like you've done 100 like sit-ups or crunches. So
bizarre feeling.
I know, it's weird. I can feel it now, actually. I don't know what it's because I was on my feet last night at the awards ceremony. Oh my gosh, we won an award last night.
It was a big epic celebration.
It was so exciting.
Inspiring Workplace 2026 in the UK.
It's so
Come
so
on,
cool.
KVA.
I know, it was amazing. We saw Aldi supermarket, we saw Lloyd's Bank, and we beat them. It's just amazing. We got a lovely shiny trophy. High five. Which is all about putting people first, which is, it links really nicely to what I've tried to do with the journey, the recovery for the tummy tuck, because there's so many women out there who, like you said earlier, are really frightened of having this surgery. There's a lot of women who said, I'm scared of the pain, but I know that I want to do something. There's women who are putting their life at risk when they're going off to these random clinics in wherever they're going. And I just think we need to have a way that these women are safe, they're listened to. Every single clinician in secondary care within the NHS is aware if someone presents with back pain, with urinary incontinence, and they've had babies, could it be that muscle repair would potentially help them? That needs to happen. I don't know how we make that happen, but NHS England, sort it out, because it needs to happen.
And thank you so much for sharing your story. And to close on that, if you could go back to the version of you before the surgery, what would you tell them?
Wow, the version of me 13 years ago, I would have said, get it done immediately, because that's 13 years of your life that you can't get back. But I just hope that people, just by listening to this and sharing the awareness, that people feel bolder and braver to have those conversations with their healthcare professionals, and to do the research as well, because those studies are out there, they're in the public domain, you can Google them. And I also actually just want to explain how this works, because another question that I get asked quite a lot is, how does that muscle repair help with things like back pain? So if you think about your abdominal muscles, they almost act like a corset for your internal organs. They hold everything together. And obviously then you've got your abdominal cavity. And with everything being held together, and if you think about tightening a corset, when you do that muscle repair, that's essentially what you're doing. You're pulling that corset together. What that does is increase pressure in your abdomen, but it's also almost doing a very gentle lift of everything. And you can see it physically. You can see, I was talking to someone about this the other day. You can actually see like your fanny at the front, like lifts up, like it looks completely different to what it did before. So and you can see my old belly button scar, which is maybe 6 inches lower than where it used to sit. It's really weird, but everything is like pulled kind of upwards. And so in doing that, what that does is give the bladder the support and the vagina, because as we age, and this is more common as well, like in women as you age, all of the elasticity that naturally happens, all you're doing is pulling everything back together. And that's why it helps to...
As it should be.
Yeah, exactly. Yeah, and as it should be after pregnancy. Absolutely.
Amazing. Thank you so much for sharing your brave story. What a journey. And I think it's just being so vocal about these things that helps other women.
Yeah, absolutely. I think every time that I'd put into Google when I was researching tummy tuck recovery, all you ever get is kind of just excerpts on a website from a clinic or advertising a surgeon or whatever. I think it's important that patients kind of
have the voice.
Yeah, and we've spoken about advocacy and kind of standing up for yourself and things, but actually then being able to share that makes a real difference. So I hope that it helps other women out there who are in the same boat. I really do.
I'm sure it will. Well done, and thank you.
Thank you so much.
Thank you so much for listening to today's episode of Health Applied. We really hope you enjoyed diving into those conversations with us.
Please do like, share, subscribe on YouTube, follow us on Instagram. Your support and engagement makes all the difference to us. If you want to get in touch with us, our Instagram handle is @healthappliedpodcast, or you can email us on hello@healthapplied.co.uk.
Onwards and upwards.